Sharon for inviting me. I don't know if Sharon's on the call yet, but anyway. So Sharon asked that I talk today about a practical playbook, public health and primary care together. Sharon has actually been on our National Advisory Committee for this playbook, as is Joy Reid and Lillian Shirley, so some other public health nurses that you all are familiar with. So I'm going to go ahead and see if I can do this. It looks like I'm doing okay so far on advancing the slides. Ooh, yes, okay. Everybody sees these, I hope. And you've probably seen this slide over and over again, right? This is the variant on the slide about how the U.S. spends more than any other country on the world on health care. And you can see the U.S. I don't know if you can see my mouse on this, but that little blip off the curve is, of course, the U.S. So while we spend so much more for health care, we get so much less. And I just saw another presentation where somebody actually showed both healthcare expenditures and social expenditures, and we spend far less as a proportion on social expenditures than any other country, which may explain why we have the poor outcomes that we have. Then the next slide is one that I
Could you speak up a little, please? We're having trouble hearing you.
Okay. Is this better?
That's much better.
Okay, I'll try to keep this headset close to me. Trying to manage computers and phones. I'm trying to do this hands-free. So let me know again if I need to speak up. And I think this slide actually from my playbook colleagues actually has a typo. I think that we're talking about the increasing burden of chronic disease. I think non-communicable diseases accounted for less than 20% of deaths at the beginning of the 20th century. So I think that should probably be 1900. But the main point, of course, is today they account for 75% of deaths in the United States. And as one example, of course, is asthma. This is one that you've been using a lot, that the number of people diagnosed with asthma...
Excuse me, we still can't hear you very well.
Okay.
Sorry.
All right, well, I'm going to go ahead and switch from headset. We'll see if I can handle all the the controls with the headset. I'm going to pick up my phone in my hand and see if that helps, okay? Just a second. Okay, is this better? Hopefully?
Yes.
Okay. So see if I can multitask here. So asthma, asthma, we've got lots more people diagnosed with asthma each year, and asthma costs the U.S. about $3,300 per person each year, and also other indirect costs and medical costs, lost school and work days, early deaths in 2007, and a lot of visits to the emergency room and patients that are come back for repeat visits in primary care. And there's some real challenges in terms of our ability to take care of patients with chronic diseases versus the, as you might say, simpler model of infectious diseases where we control the infectious agent. One of the examples we've been using about what we can do together in public health if we work with primary care is some of the resources that we in public health bring are on the slide right now. Educators, epidemiologic data, ability to communicate with media, we have their attention, connection with other agencies in addition to public health. And primary care, of course, has the providers and the relationship to the patients, and electronic health record billing systems. But the challenge, of course, could be, for example, if you are a primary care provider who's seeing a few different patients, kids with asthma, and you have different health insurers and you're only seeing a few, but the next provider that you don't talk to on a regular basis is seeing yet another kid with exacerbated asthma, and then there's a few others so that we have a cluster of asthma. If there were better communication with us in public health, it might be that the public health agency could investigate the cluster and find out that these kids all ride the same school bus, and that school bus has a clogged tailpipe, as you can see in this picture, and maybe that is what they're doing, is they're all breathing the exhaust and exacerbating their asthma. So these are some of the reasons that we might want to work together with public health, primary care. How can the Practical Playbook help? The way we've set up the playbook is it's got sort of these icons for learn, do, and share. And hopefully you've either seen the playbook or you can go to the playbook afterwards and give us feedback on how this is useful or not useful, ways that you can improve it, and tell us more, give us more stories. just as you were talking about stories as I came on board. So just to look quickly at the playbook, the Learn icon is about learning, providing a portal for those who want to learn more about integration, about why would you want to collaborate, what is integration, not that it means that healthcare is taking over public health, of course. It's about collaboration and moving along the spectrum of integration so that health is provided more seamlessly. But so why should you integrate? Why integrate now? We also have in the Learn section, or just as part of the playbook, an ability to search the playbook to look at all sorts of cross-cutting topics, how you can learn more about disease areas and tools, accountable care organizations, etc. There's also a Do section that is the portal for those who are really, they've learned and now they're ready to collaborate. It's guidance around topics like how to work together, who to work with. We have often found, as I'm sure you have probably experienced this as well, that sometimes the healthcare system doesn't even know who's in their health department. They don't always know that we exist. They don't necessarily know how to find the health department. So we try to give them links to various different public health organizations, or just tips on how to find their health department if they don't know that you can Google the health department, and also how to navigate the 5 stages of integration. The other thing to note, since we're on a Million Hearts call, is that you can actually search for disease-specific topics and find not only answers about what we have in terms of tools specific to something like this one is hypertension and high blood pressure, but also success stories, places where public health and primary care are successfully working together around hypertension, let's say. Or, for example, you could search, since this is about Million Hearts, you could search on nutrition and physical activity and find the 22 resources and the 4 success stories around nutrition and physical activity. And you'd have to scroll through a few of these. Or we could look for smoking and tobacco and find the 8 tools and resources and 1 success story for those. And on this site, you can look by disease-specific tools. You can also look for other tools and resources under the tools bar and find the nearly 700 tools, again, searchable by topic and location. Then, of course, we have the other last part of the playbook, which is the share portal, a portal for those looking to share the success. Because as you were pointing out about collecting stories about public health nurses, we have found that there's a lot of successes already out there. People are not waiting for national policy necessarily. There are people out there on the ground, many of you, who are already working together with primary care folks. And we thought it would be helpful to motivate folks by reading and to inspire people, read about other projects. So far there are more than 35 success stories from across the nation that are highlighting successes and lessons learned. And again, as I mentioned, there's 4 stories related to hypertension. There's many other related to diabetes, smoking, physical activity, stroke, etc. And those, we actually have many more success stories that are actually in the queue. We just are loading them up after what we do is we get the preliminary story about success, and then the Duke team actually interviews the folks involved in the story. And then they put a short summary together that might have a quick summary, as you can see here with the Maryland one, a few lessons learned or tips from that particular project, some background information that might include how they got started, what their focus is, who their partners are, some of the methodology that they're using, what are they actually tackling with regard to, in this case, Million Hearts, what is their plan for sustainability, which is often addressed in a section labeled Moving Forward, what are their results so far, what's the contact information, how do you get a hold of the key point of contact who's behind this success story, or you can contact the playbook for more information. And then, as you see on this one with Million Hearts, Maryland Million Hearts, some related tools and resources that these folks might have put together. So the why integrate, this was a fun slide that was, I think, identified by my colleague at the de Beaumont Foundation. You know, the donkeys who are pulling in opposite direction because we have, unfortunately, for too long had public health and primary care or public health and health care not working together and, you know, working on our individual, or for them, primary care, individual level care and working on populations. And rather than trying to pull against each other, there will be many more opportunities if we can actually work together to improve health outcomes. So I deliberately have kept this short. I wanted to see what kinds of questions you have. I do want to encourage you to check out the playbook and to know that it's a living site. This is not the be-all and the end-all. It's not finished. It's sort of version 1.0 so that we can start, and you know, we had to pick a date to go live, but we want it to continue to evolve and to collect various success stories and tools to reflect the range of workforce that contributes to health, obviously nurses being key, but also a range of geographic areas and conditions and environments and communities, because around the country there are going to be different conditions, right? Different, whether rural or urban, different healthcare systems, you know, whether one or multiple, different health department setups, and we need to have various different success stories. And hopefully, as we continue to improve the rigor of the success stories, we'll be able to have people search by, you know, was it rural or urban, or what kind of health plans were in that area, so people can learn more about the successes in various different areas. So I will stop there and see what kinds of questions people have.
Dr. Koo, hi. This is Karen O'Brien from APHN.
Hi, Karen.
And thank you so much. I'm thinking that the stories we're collecting for the ASTHO project might be of interest to post on the playbook.
Yes, I was wondering that myself as I was hearing you talk about it. So that's great.
And how do we, probably ASTHO knows this, but how would we then submit stories, or how would anyone submit a story?
Well, so there's a couple different ways to submit stories. One is, of course, the ASTHO supported Primary Care Public Health Collaborative, and you can see that on the ASTHO site, has a link for the Primary Care Public Health Collaborative or Integration Collaborative right on the ASTHO site, and there's a button you can click there to submit success stories. And what happens is that's shared with the Duke team that's working on the Practical Playbook, and they actually then follow up with questions and sort of a qualitative interview. Your stories may or may not be in a more complete format already, and it may be that it would be easiest for us to have you send them to the link on the playbook. There's a URL, an email address also for sending information to the Practical Playbook. So you can use that. You could always send it to me, and I can forward it to the folks at Duke, which is where the PI is on this project, and folks can look at it. We tend to like to have things in chunks, and so that if there's a place where you're going to post the stories, we could also just link to them. So it's, there's various ways we can go. If there's stories we want to call out in short little vignettes, just as we have on the playbook, that would be something that the playbook staff could work with you all or the primary on each of those, and or if this document that you're producing is going to be posted on the ASTHO site or APHN site or something, we can also provide it as a link, as a tool and a resource for people to learn from.
Excellent. And we are actually recording in several different formats. We have an Excel spreadsheet with all of the stories, and they're listed per question, then the responses. So it categorizes. It helps with the categorization. But then we also are going to be creating vignettes for the issue brief. So we'll have it in several different formats, but probably the most efficient way will be this spreadsheet that possibly might be of interest if people were going to the playbook and wanted to see the public health nursing contribution to the project. This would be a real direct way to get to that information.
Okay, great.
So I'll stay in touch with you on that, and I really appreciate this resource. This is great. Thank you.
Any other questions?
I'm curious to know if there are folks on the line that have been able to use the playbook. Did you already know about it? Is this something new, a new resource for you, or have you used this resource?
Hi, this is Sandy from Illinois. I happened to see this at APHA last fall and got a little preview of it, and so I was able to kind of stay in tune with it, and I had distributed, as soon as it was released, I had distributed it to our participating partners in our county health departments and in our clinics. So I actually think it has a lot of good potential and a lot of good resources. I'm really anxious to see it evolve. It's a great start.
Excellent. Thank you. And we are investigating a email address that would be at Practical Playbook. But for now, if you go to the site, and I'll just read it right now also, I see a question on the web that says, what's the contact point? If you go on the playbook itself, it says Practical Playbook at duke.edu. So that's a mailbox that's also very frequently monitored by the Duke folks. So various ways. I mean, certainly feel free to email me, but there's also the Practical Playbook at duke.edu, which is a recorded site. We've got all of the emails that go there are recorded and tracked. Excellent. Any other questions, comments? Hopefully folks will, again, look at the site. As I said, it's a site that is a start, not a finish. Obviously there's a lot of work going on in this area of public health and healthcare integration. And so it's a rapidly evolving field, and we hope to keep this site to evolve with the field as well and upload more tools, resources, success stories as we learn about them or as the staff can keep up with them.
Great. Well, thank you, Dr. Koo. That was a really great presentation. And again, you can see on the screen the website. And if you have any other follow-up questions, please feel free to email me, Tara Johnson at ASTHO, and I can direct them to the right person.
Excellent.
Great.
Okay. Thank you.
Well, thank you so much for your time, Dr. Koo. We appreciate it.
Great. Thank you. Thank you for having me.
Absolutely.
All right. Bye-bye.
Bye-bye. Thank you.